Welcome to our community health presentation on Charlotte, North Carolina. The focus of this presentation is on the prevalence of cardiovascular disease among African Americans in the NODA and North Charlotte region of Charlotte and Mecklenburg County. There are various health issues that are prevalent in Mecklenburg County in a variety of diseases and processes. Of the health issues in this community, we chose to focus on cardiovascular disease. Why cardiovascular disease? Cardiovascular disease is the second leading cause of death in Mecklenburg County, and many of the risk factors for cardiovascular disease are very preventable. In order to investigate this disease further, we wanted to find a location with high rates of the disease in the county. After investigation and research, we selected the NODA community in North Charlotte. From here, we examined the environment and population and the resources in the community, ultimately narrowing our focus to African Americans with this disease. Strengths and weaknesses of the community were examined and diagnoses and interventions formed to ultimately help reduce the rates of cardiovascular disease in this community. In order to really immerse ourselves in the NODA community of North Charlotte and to gain primary data, we conducted a windshield survey. What we saw in this survey is that the community is bordered by a large interstate. The housing in this community is old. There are some trendy houses being built, but the majority of the homes are old, run down, and not very well taken care of. There are numerous common areas and open spaces for running or walking or physical activity. We did find numerous homeless individuals in these common areas. In regard to transportation, most individuals got around by foot or by taking the city bus. The cars seen were old, run down, and outdated. Numerous individuals were smoking while roaming around outside. When it comes to culture, we found that NODA is a very artistic community. There are numerous fast food restaurants in the area and a lot of advertising for these restaurants. There were several new trendy restaurants and bars, along with a couple fresh food stands, but the price tag at these establishments was likely not affordable for the population we saw. There were many races and ethnicities represented, including Caucasian, African American, and Hispanic, as well as many homeless individuals. Access to health care in this area is limited. There are minimal doctor's offices and dentists in the community. In order to gain additional insight into the community and prevalence of cardiovascular disease in African Americans, we interviewed an RN at a low-cost clinic in the area. We were able to gain additional information on the challenges that this group faces. She felt that obstacles for the African Americans in this community were access to health care, which we saw in our windshield survey, noncompliance. She stated many individuals are noncompliant when it comes to eating healthy, exercising, and taking medications as prescribed. She also noted lack of understanding as a challenge. Many of the individuals in this community are of a lower educational level and simply do not understand the how or the why. Asked about keys to improvement, she noted that there should be more low-cost clinics. In addition to this, there should be free screenings where individuals are able to monitor their blood pressure and cholesterol, improved educational initiatives, and an emphasis on follow-up care. In the clinics, they have a high rate of noncompliance with follow-up care. And lastly, just simply motivating individuals to understand that how and the why. We're going to move on to our secondary data and demographic data. As you can see, the population in 2015 of Charlotte, according to the U.S. Census Bureau, was a little shy of 810,000. This was pretty evenly split between genders, with 48% male and 52% female. We're going to focus on educational statistics. We're still going to focus on demographic data here in relation to education and income. And as you can see here, the rate of residents in this county having a high school graduate degree or higher is 88%, and bachelor's degree or higher is about 40%. In regards to income, you can see the median household income there is around $52,000, poverty level 17%, unemployment rate 15%, and median home price is $140,000. What we want to note here is that people with higher levels of education and income tend to have better health outcomes and lower rates of many chronic diseases compared to those with less education and lower income levels. So, we're seeing not a lot of income when we did the windshield survey in the NODA area and lower education levels. So that's an important note to make. Here you can see that about 20% of people speak a language other than English, and some other general statistics. We have about 47.5% of individuals are married. The median age is about 33.4. Average commute time is about 25 minutes, and the household size is about 2.5. And what we want to note here with language and race is that cardiovascular disease and diabetes are leading causes of death in Mecklenburg County, and while deaths vary by race, there are few disparities in the prevalence, suggesting that indicators such as education and income or access to care may play a more important role in the overall health status than just race alone. Several of the largest employers in the area are Carolina's healthcare system and Wells Fargo. We did not see many of these represented in the NOTA region. Other large employers include Walmart, Bank of America, CMS, which is a school system, Novant Health, which is the competitor of Carolina's healthcare system, American Airlines, and Lowe's. And again, we did not note many of these businesses in the NOTA region. You can see here, cancer and cardiovascular disease are the leading causes of mortality, resulting in over 50% of deaths in Mecklenburg County each year. Stroke was the fourth leading cause of death during 2008 to 2013, and diabetes is the seventh leading cause of death and also a major contributor to the development of heart disease. Lower chronic respiratory disease, which includes emphysema and chronic bronchitis, was the fifth leading cause of death in 2011. Now we're going to examine some of the statistics related to risk factors that cause cardiovascular disease and really other chronic diseases as well. When we look at physical activity, 20% of individuals stated that they didn't exercise at all in the last month, and also 20% admitted to smoking, which in the NOTA region we felt like this was a little bit higher. When it comes to healthy eating, a whopping 81% of people reported eating less than 5 servings of fruits and vegetables a day. And this is very important to implement a healthy diet when we're looking at cardiovascular disease, so definitely something that needs to be addressed. 33% of the population had elevated cholesterol, and these are actually the people who knew they had elevated cholesterol. And then 28% reported having high blood pressure. An alarming 62% of people in this area are overweight or obese, and this is one of the main contributing factors to cardiovascular disease, and again, something that needs to be addressed sooner than later. When we look at chronic diseases by race in the area, we see that with cardiovascular disease, there are more individuals that are Caucasian that have the disease than African Americans, but when you look at the population, the percentage of African Americans having the disease is much higher, and there's actually a 1.5 disparity ratio between African Americans and Caucasians in the disease. So there we see about 20,400 African Americans have cardiovascular disease in the region compared to 35,200 Caucasians. Again, though, the percentage based when you adjust the population levels is much higher in African Americans. This graph just further supports what we just discussed in saying that the population of Caucasians is higher in the area compared to African Americans, and although there are more Caucasians who have cardiovascular disease, the percentage in African Americans is much higher. When we look at lifestyle data, we can see that substance abuse is a problem in the area, a lot of marijuana use as well. When we look at environmental health, the air quality in Mecklenburg County actually did improve from 2002 to 2012, which is definitely a positive stride in that direction. And then there's actually 37 miles of developed greenway in 2011, and there is a lot, like we mentioned, a lot of green area, room for physical activity in this NOTA region, so definitely something that we can make use of. After analyzing our primary and secondary data, we came up with strengths and weaknesses of this NOTA community. The strengths we found were that racial and ethnic diversity is really great in this region compared to most other areas of Charlotte. There's a broad socioeconomic mixture, so you have people of higher incomes, people of lower incomes kind of intermingling. And it is a growing community, so it's an exciting time for this area. There's plenty of environments for physical activities, and there are, although they may be a little pricey for some individuals in the region, fresh food markets. When we look at weaknesses, as we've mentioned, there's poor health literacy. We need to improve the health literacy of these individuals to improve their health outcomes. There's a low availability of health services. There's not a lot of doctors, not a lot of dentists in the area. And simply the availability, as we mentioned, and affordability of healthy food compared to fast food in the area. When we look at the strengths and weaknesses of the community, we came up with community health diagnoses for this community. And what we saw is that there's ineffective health maintenance and there's a lack of knowledge related to wellness. The health problems that this community faces are cardiovascular disease, poor health literacy, and the minimal perceived access to health care. Areas and people specifically affected by these health problems in this community include low-income areas, the homeless, minorities, specifically the African American population, and individuals with high school education or less. And we saw a lot of this in this NODA community. What's exciting is that cardiovascular disease is very preventable. There's actually a 4-to-1 ratio between the modifiable risk factors and hereditary risk factors of cardiovascular disease. So this means that factors people can control contribute a lot more to cardiovascular disease than factors they can't control. So a lot of our effort here is going to focus on primary intervention. So what we want to do is improve the health literacy of this NODA community through health and illness prevention. We're going to focus on education, promoting proper nutrition and diet, and physical activities. These individuals need to know how important a low salt and proper diet is, as well as exercise. We want to team with schools, businesses, churches, and healthcare organizations to initiate these initiatives. And we're going to focus on tobacco-free environments. We saw a lot of smoking in this area, another risk factor for cardiovascular disease. So we want to focus on implementing tobacco-free environments. When we look at secondary interventions for this community, we really want to focus on halting the disease of those who have it. We want to implement exercise programs and regular exams and screening tests for this community. So our strategy here is just to increase the compliance through the availability of regular exams and screenings in the area. So we're going to partner with the American Heart Association, the big healthcare organizations in this community, which include CHS and Novant, to provide screenings and exams. And what we can do here is have volunteers come in and conduct blood pressure screenings for those who have cardiovascular disease, cholesterol screenings, implement plans for diet modification, making sure people are having a consistent diet that is heart healthy, and then looking at medications and giving medication refills so people are more likely to be compliant with their medications. When we look at tertiary interventions, what we really want to do in the community here is soften the impact of those with cardiovascular disease. So we're going to partner with Mecklenburg County and try to really implement a chronic disease management program in the area. This is going to focusing on managing the ongoing illness. It's not really in the acute phase, but we're going to look at this more as a long-term phase. We're going to form support groups so individuals can get together and talk about their problems or concerns and simply just be there for each other. There's Physicians Reach Out, which can also help, which is a volunteer physicians program where they can come in and help with the disease management, as well as a community alternative program and that focuses on disabled adults that are 18 and older and the elderly population that may have the disease. So they can help here too in managing the disease through in-home care. Several barriers to change and challenges we'll face as we implement these interventions, and one of them is transportation to the clinics outside of walking distance. As we mentioned, a lot of people walk in this area, so this is where that community alternative program and disabled adults can help. There's also community bikes in the area that individuals can use, and then just simply having people, when they're scheduling appointments, helping them set up transportation options. Hours of operations also important. A lot of people are working at fast food restaurants or are working, at places where they have an 8 to 5 job, and so we need to offer non-traditional hours for these patients to get in and get help and get seen. Another barrier is language. We need to have access to a language line or video interpreter if need be. The scary truth about cardiovascular disease is that it is often a silent killer. Many people with the disease don't even know they have it or don't have access to health care to know they have it. African Americans in the NODA community of North Charlotte are at increased risk for this disease. They have higher rates of unemployment, lower education levels, and lower income levels. All these put them at risk for the disease. The rates of cardiovascular disease, the lack of health literacy we discussed, and the accessibility of health care are all major problems we see in this community. What we really need to do is focus on primary interventions along with secondary and tertiary interventions as well. Partner with local organizations to prevent this disease in African Americans and ultimately provide them greater accessibility to health care. Here are a list of references for the presentation. Thank you for your time.